Well, good morning, Mississauga. I'm David Wojcik, the President and CEO of your Mississauga Board of Trade. It's our great pleasure to have you join us this morning for our virtual fireside chat. Today we have a conversation with an icon in the pharmaceutical industry. Ronnie Miller is the President and CEO of Hoffmann-La Roche Limited, also known as Roche Canada. Before starting our event today, I'd like to quickly review the virtual event protocols for this event. All attendees will remain on mute as we are recording the event. If you have a question for our guests during the fireside chat, please use the Q&A button at the bottom of your screen. Enter your question, and we will do our very best to get it on. Only our staff and panelists can see the question, so don't worry about that. And it's interactive. So as you think of a question that you would like to pose to Ronnie during the conversation, put it in the Q&A and we will get it on. I'd like to thank our sponsors for our From the Corner Office series, Kaiser Mason Ball and Gallagher Insurance, for their continued support. Now, I would like to welcome Amy Delisle, the managing partner for Kaiser Mason Ball, to say a few words and officially introduce our guest. Amy?
Good morning. I'm Amy Delisle, as David mentioned, and I am the managing partner of KMB Law, a business law firm with locations in Mississauga and Burlington. So I have the pleasure of introducing Ronnie Miller today. Ronnie is the president and CEO of Hoffmann-La Roche Canada. In his role, he is responsible for the growth and success of the Canadian Pharmaceuticals Division, particularly as it relates to the company's mandate of developing and delivering innovative healthcare solutions for Canadians. Ronnie has more than 40 years of extensive and varied experience in the pharmaceutical industry. After completing his Bachelor of Science in Economics and Geography at the University of Glasgow, Ronnie moved to London to accept a job as pharmaceutical sales rep. He advanced through a series of successive sales and management positions across the industry to become the national sales manager for Roche in the UK in 1979, and continued to move globally as project manager in Switzerland and deputy divisional director of the pharmaceutical division in Japan. Ronnie was appointed as president and CEO of Roche Pharmaceuticals in Canada in April of 2000. During his years in the pharmaceutical industry, Ronnie has seen the sector transition from a one-size-fits-all approach to one that is founded on the individual and the delivery of precise medicine. Ronnie believes that Roche as an organization has embraced this philosophy and as such is well positioned to maintain its leadership in innovating the way healthcare is delivered through the integration of its pharmaceutical and diagnostics divisions. Born in Scotland, Ronnie became a Canadian citizen in 2008. When he's not working, Ronnie can be usually found on a golf course in and around Oakville, a sport he enjoys with his 3 daughters who share his passion and a strong sense of competition. He also enjoys traveling with his wife Colette and spending time in their family home in Florida. Please join me in welcoming Ronnie Miller, President and CEO of Hoffmann-La Roche Limited, Roche Canada. Thank you.
Thanks, Amy. Good morning, David, and good morning, everyone.
Well, good morning, Ronnie. And it sounds like you've got a few languages that you might speak there. So you did a stint in Japan. How's your Japanese? Konnichiwa.
Yeah, konnichiwa. Dozo yoroshiku onegaishimasu. It's the strangest experience for a Japanese to hear a Scotsman speak their own language. And I've often surprised groups of Japanese tourists by offering to take a photograph, but asking them in Japanese. So that is usually a party piece. And when I start again, it comes back to you quite quickly because you have to at least learn some combat Japanese to get around there. A little bit of French and a little bit of German too. But of course, being Scottish, I struggle with English. So that's my main challenge.
So Japanese with a Scottish accent, I'm sure that is quite entertaining for the Japanese to listen to. Ronnie, let's start from we're going to start from the beginning. We're going to find out a little bit about your history, but I know a lot of people that have tuned in today certainly want to know what the update is on COVID-19. So if you can give us a little bit of an update and also talk about the discovery in the UK with one of the arthritis drugs that Roche has introduced and how that's playing a part in COVID-19.
Yeah, I mean, I think the industry, a much maligned industry often in Canada, has done a marvelous job initially with testing to identify patients who were positive with COVID. And I think the vaccine companies you know, AstraZeneca, Moderna, Pfizer done a superb job very quickly to make vaccines available as fast as they've done. I mean, lightning quick research. And I would certainly recommend everyone eventually gets a vaccine. I think vaccines, if there are any side effects, would occur quite quickly. So we should be very proud on that side of what the industry has achieved, aligning with government and trying to get through this COVID madness. The other aspect is drugs which are available, one of which is a drug called Actemra, which is a Roche product, actually initially available for rheumatoid arthritis. In some research in London now, they've really found some benefit in late stage COVID patients. Actemra stops the inflammation cascade. So as I think, David, you and I chatted about earlier, patients heat up and it's a very, very nasty thing. It can actually lead to organ damage. So we know there's a 25% improvement when Actemra is being used, and it's been tested and used across other jurisdictions across the world. Other products and other companies also been tested in likewise conditions. I think the industry is getting a grip on how to treat COVID.
So I know there's been you know, lots of chatter you know, about at the federal level about numbers of vaccines, but that's going to be a conversation for a minister to answer. We won't burden
Yes,
you.
please.
We won't burden you down with that one.
Thank you.
We want to know about Ronnie Miller. So Ronnie, take us back to Scotland. You were born just south of Glasgow, and tell us about growing up. When you were a wee bairn, did you always dream of being in the pharmaceutical industry and running Roche Canada?
Yeah, it's a great question. Well, actually, I was brought up in a small village called Stonehouse, and our family home is right opposite the local hospital. And from the age of 15, I started working as a porter over the summer holidays, and I did that all the way through university. And what piqued my interest in pharmaceuticals was twofold. One, my wife's brother was a regional sales manager for Janssen at the time, and also I used to meet all those medical representatives coming in who tentatively were trying to find their way around their hospital. So as I approached the end of my degree, I started asking about jobs in the industry, and I got a whole host of interviews before I even graduated. So that got me into the industry, and I started as a medical representative at 21, which was relatively young even in those days. And the rest is history.
And the rest is history. So take us through the different, you know, Amy mentioned about your travel, your journey through the organization. You spent time in, you know, in Switzerland, Germany, and Japan. Give us that timeline.
Yeah, I think so. I started, it seems amazing now, back in the late 1970s, a long time ago. I think bell bottoms and platform shoes were still hanging around. The traditional career at the time was to start in sales and then move into marketing, which I did. Become a district sales manager, so you're responsible for people, which I did. And then I think with increasing promotions, the opportunity came up to take a global job in global marketing, and I went to Switzerland to do that. And then you expose yourself to the international corporation. And at the time I was visiting Portugal, and the Portuguese GM was Japanese. He liked what he saw, and he ended up back in Japan running our Japanese operation, plucked me out of global marketing, and actually placed me into Japan to head up marketing in Japan. It was a phenomenal experience. So my wife and I up sticks and moved there in 1992. And it's an incredible experience to go to a country where clearly you're a foreigner. Everyone knows you're a foreigner. You don't speak the language. And Japanese people, unless they've had a few beers, don't like to try to speak English. When they drink, they're actually very comfortable to do that. But normal day to day, it's quite tough. And our 3 daughters were all born in Japan. It was the most wonderful experience for the 4 years almost that we lived there. And we lived right in the middle of Tokyo. We could see the Ginza out of one window, and we could see Mount Fuji out the other. And I had the benefit, my wife less so because she was pregnant most of the time. I traveled all over Japan and really got to know the Japanese people well. And you know, there's a great saying that if you look at the 2 big Asian countries, Japan is a capitalist country full of communists, and China is a communist country full of capitalists. And I think that actually describes the environment incredibly well. And even now, Roche bought a company called Chugai, main Japanese company, and even the Japanese executives, when they come, as soon as they know you've spent time in Japan, they congregate to you because they know that you understand the culture and at least know a little bit of their language. But a phenomenal experience. Then I went back to Switzerland to take on a global project. We were having some problems in the UK, so I was back in the UK by 1997 as head of pharmaceuticals. And then I had the chance to come to Canada in 2000, and we thought, yeah, lovely, let's go to Canada for a few years. That was 21 years ago. So my kids were young when we came. I have twins who are now 26, and my youngest is 24. And we've had the wonderful opportunity to stay here. They've tried to squeeze me out a few times and take me here or take me there, and I've always said no. And I was an expat here for 12 years. I was still an expat in 2012. So the expectation was I would go Europe or somewhere, but I've stayed. And I'm delighted that we did that.
Now, many people, may think that you were just parachuted into the top job here in Canada, but getting that context of the travel and the uprooting of your family. So you mentioned that all three of your children were born in Japan. So does that make them Japanese citizens as well? And do they still speak Japanese?
No, they don't speak any Japanese. But the funny story, when we became Canadian citizens, we were, I guess, inaugurated and the whole thing done in Hamilton. So we drove down to Hamilton, we're sitting in the audience, and then they read out where people come from who are attaining Canadian nationality, and they said there are 3 people from Japan. So we're looking around because Japanese people don't normally change nationality. It was my 3 daughters because it was where you were born that was the important consideration, and they were all born in Tokyo. So that was one thing. And then the judge who was passing on our nationality, he went to the same school I did in Scotland. So we held up proceedings while we exchanged notes about Larkhall, which was the town that I went to school in. So small world and typically Canadian.
Absolutely. Tell us about some of the challenges of uprooting your family. I mean, we hear this with CEOs that partake in that global journey where you're jumping from country to country, and for the most part, people's families do travel with them. So, what are the sacrifices that you and your family have had to make during that global jaunt?
I think, David, mainly is familial support. I mean, I remember once coming back from a meeting in Switzerland, and at the time, Colette and I were on the 24th floor of an apartment building in Tokyo. And of course, it's a long flight, it's 12 hours. I'm tired. I had a wee dram or two on the airplane, and I'm coming down the corridor, and I hear these babies crying. And I thought all I wanted to do was go to bed. But as I come in the door, I get handed one to change the nappy while my wife was bathing the other. That's twins for you. So I think getting the support was critical. We did have a Filipina lady who helped us enormously, but there are no sisters or family where you can drop your kids off as you would do in your own village or own town. That was a challenge, and also just spending time as the kids grew up. I traveled enormously, so I didn't see a lot of them as babies, really. So the one benefit, I think, that's God's way of getting his own back. Now I've got 2 daughters back home because of COVID, so now they beat up on me now in the mid-20s, which is lovely. It's a wonderful opportunity to reacquaint. One was in London and one was in Edmonton, so and the third one is in Australia now, so the only way we see her is through FaceTime. But I think that's the biggest challenge, is keeping the family together when you're pulled away for work. And I was, always on an airplane going somewhere.
And did you uproot the family and take them each way? It sounded like at some point they were stationary and you were traveling around, or did they travel with you to certain countries?
No, they traveled everywhere. Fortunately, my wife's elder sister, she was married to a farmer in the north of England. They have a beautiful home just outside of Hull. So that became the changing base. So they went there for a month at a time while I settled into the new job somewhere. And I would say the hardest pressure was on my wife. As you go as a senior executive in a company, it's fresh paint and new carpets everywhere. But my wife had to find a home and set everything up and sort out the moving men. I never seemed to be there when the people were moving stuff into the house, often by intent. So that's a challenge. That's a big challenge.
And looking back on how you went through that journey, and I mean, once we get through COVID, a lot of these types of transfers are going to start happening again. What advice would you have for people that are considering this type of journey where they're going to go from not just city to city within the same country, but country to country with a family in tow?
I think it's a wonderful experience. It's a thing you've got to embrace and enjoy. So you have to have the right attitude of mind to do that. The learning, I mean, the one thing I learned, or two things I learned in Japan was how to speak English, because if I'm unintelligible now, I was very unintelligible going to Japan. So you had to speak slowly and precisely to be understood, and patience. Because the one thing about the Japanese, they're very, very patient. If you think you're going to get through a 10-point agenda, forget it. You'll get through one point. And so it's learning to deal in different environments, to understand multiculturalism, and there's no finer place to explore that multiculturalism than Canada. So you learn these things in different environments. You see a different part of the world. You learn different foods and different, living conditions. I mean, I remember once for 3 weeks in Tokyo in our final year, it was 40 degrees and 100% humidity, 24 hours a day for 3 weeks in a row. So you get up in the morning, get showered, get dressed. And the minute you walked outside, you were sweating. You may as well go back into the shower. I mean, Canada can be warm, but it was never as hot as that. And just to experience the world. And I was brought up with the philosophy, it's better to have tried and failed than never to have tried at all. And I would certainly recommend someone go and try something different in another world. It's great for the kids too.
Looking back, would you do anything differently in the career path or in the journey or any of the experiences?
Not at all, not at all. And the best decision we ever made was to come to Canada. I think when I reflect on education, though, if I think back to the late 70s, everyone who took computer courses at that stage did incredibly well, because it was just before the tsunami of technology that came. And I think if I had to do things slightly differently, we'd take some experience in that space. But I do not regret healthcare or pharmaceuticals, because it's a continuous learning curve. You never stop learning.
Now, Amy mentioned about your education, science and economics. Those two don't normally go together. Why did you choose that path?
Well, it's geography and economics, so I can find my way around the world cheaply has always been my answer to that question. I probably wouldn't get an interview these days. The quality and the qualifications of people that we interview, phenomenally good. I mean, people with MBAs, with Masters of Biotechnology, I'd be at the back of the queue. But this was the 1970s, not 2021.
So now that you're at Roche, you've been here since 2000. When you came to Canada, were you installed as the president and CEO, or did you have another job?
No, I came as the president and CEO. The company at the time was much smaller. I think now we've probably, in sales terms, about 4 times the sales, and I think we're still managing with the same number of people in the commercial division that we did then. So we've had a phenomenal success. We're close to $1 billion. We did $1 billion last year in sales. When I came here, it was about 290 million. So we've seen phenomenal growth in that time period.
Well, you may have already answered the question that I'm about to ask, but 20 years for a global CEO, that's a lot of years. I mean, normally, it's 5 to 7 years, and then you're off somewhere else. What do you attribute your longevity to?
I think they just haven't found me out yet. I often get asked that question, and I think seriously to answer it, you have to ensure that you change things. Don't let people come and influence you, but you have to see the writing on the wall. And this means sometimes moving people on, changing your executive team, changing direction. And I think we've always been quite nimble in Canada. As I mentioned to you earlier, there's a number of opportunities to move, and I've always said no. So they've been happy with my performance, and Roche are very consistent that way. I'm not alone in the tenure in my role. My colleague in Italy, my colleague in Germany, they've been there a long time, not as long as I have, but 14 years or 15 years. And I think that tenure gives a solidarity, actually. And if you're building trust and your team trusts you and know you, that helps enormously to get things done.
Well, I know in other global CEO positions, they say once you turn down a promotion once or twice, they probably don't come knocking. So you've solidified yourself here in Canada. We're so happy that you chose Canada as your home. We've got a couple of questions from the audience. We're going to get to those in just a moment, but I would like you to just briefly talk about, you had an incredible announcement just a short period of time ago, a $500 million investment here in your facility to bring the global supply chain group here. How is that coming along? First of all, how do you get that? Because people think does pharma companies compete with each other, but I have to let the audience know that you're also competing with your peers in other countries for these projects, whether it's research on a drug or manufacturing. This you were competing with other jurisdictions as well. So how did you manage to get it other than your natural charm and good looks?
There was a number of different factors, partly luck as well, but Roche bought Genentech, one of the biggest biotech companies based in California. They bought them out in 2010. So think of the time difference between Switzerland and West Coast America is 9 hours. Our head office in the US for Roche was in New Jersey. So something had to change. They wanted to move all those jobs from New Jersey to California. And we were in the serendipitous position sitting in Mississauga in Toronto, where we were only 6 hours away from Switzerland and 3 hours away from California. That helped. And then we started to put a number of jobs from the US into Canada. And it was being observed that these Canadians are pretty talented people. Language skills, great education system, universities that kick out a lot of superbly qualified graduates. And you put a combination of these things together, plus Canada's a great country to live in and interest people to come here. This all worked in our favor. So we had a group from pharma development, global group set up in Canada. And then we put IT support and we put procurement in. And all the commentary out of Basel was these are very talented people. They're not leaving to go elsewhere. They're staying and they're high quality. So this gained momentum. So when it came to find a site for the pharma technical group, the supply chain, Canada was one of the 5 jurisdictions that was a possibility. We went to the provincial government. We had their support from Premier Ford and colleagues there. So all really worked together. And I think there'll be more to come. And I always said when we moved into the office, the former DuPont building, that build it and they will come. And I think that's certainly been proven to be the case. Now, if I had changed every 3 years or a new person had come in, they're not so interested in getting that investment into Mississauga. So I think also the tenure helps enormously in that space.
We're going to switch to a question from our audience, Ronnie. In our, I think in our very first meeting in the life sciences sector, we started to talk about talent, and prior to COVID, of course, there's a massive talent gap that the businesses are experiencing, especially in technology and science and the STEMs. The question from the audience is, what would your advice be to well-educated newcomers to Canada? What would you 2 or 3 pieces of advice that you would give to them in order to help them integrate into a labor market? And these are the well-educated people, the ones that have been educated in STEM.
I think that first of all, you have to get yourself in front of interviewers, and it's a difficult process. I get that. Your CV gets posted, no one's interested in it, gets put in a large pile. You just have to keep at it to gain experience. And the first chink in armor, the first door that opens up to jump into that, because getting in is the hardest thing. Once you're in and started, I think then careers can expand. I also think there's a change in attitude to companies now looking for more global experience, to think outside of the boundaries of Toronto, Mississauga, Canada, and think a little bit globally. We as a company have gone with an agile methodology, and we're looking at roles even based in Canada that are working out with Canada because of digital capability to be able to do that. So working in teams with Europe or Asia or Latin America or Africa even. So I think the just keep at it would be my advice. And I think we'll see more and more, and hopefully more and more investment in that STEM space.
Well, that dovetails nicely. You did a beautiful segue into Agile, because that's another question from one of our attendees is, you've moved to this Agile methodology of management on a global basis. What are the benefits that you're experiencing from this management style?
Well, I think first of all, you reduce hierarchy of decision making. So you try and place it in the lowest level of the company, so that you're getting input and experience from everybody, and you're not waiting on the white knight senior manager riding in and taking the decision, probably with the least amount of information. So these are now teams that are working cooperatively, not only inside Roche Canada, but across the Roche world, and we will seek to develop that more. I would say too that you've got to work on the mindset to make sure people are comfortable to work in the agile space. Because if we're all brought up, and as I was, and you probably were, David, you looked at the senior manager for advice and direction. Well, we're looking at that turned upside down now. So we're there to coach. We're there to be architects, to be catalysts, to be you know, what's the other one? Visionary, I suppose, is the other term, but not to tell people what to do. So it's a servant leadership scenario. That takes time for everyone to accept that and to move forward. But we've been very delighted with what we've achieved so far in the space. And it's attracting people to come and work in that type of environment. All my VPs gave up their offices. They all sit in the atrium. They're very approachable. And all our goals are up on the board for everyone to see. I just can't let the competition come in and wander around the building anymore because it's too transparent. And I'm proud of the Canadians. I think too, because it's a multicultural environment, my leadership team's multicultural. We've tended to embrace this in a way that other affiliates haven't taken to quite as quickly yet. So I think we've set a great example for the rest of the Roche pharmaceutical world.
Well, you're absolutely right. You know, when you're at the top, it's so much easier and faster sometimes just to make a decision and everybody goes away and does what you need them to do. But, you know, certainly from a mentoring standpoint and for succession planning and building out a great organization, helping people come to those decisions and bring forward those ideas. It does take a paradigm shift. So congratulations on being able to do that. Another question from our audience has to do with the COVID-19 vaccine, and they're asking if Roche is involved in investing in production or manufacturing of any of the COVID-19 vaccines.
That's a great question, and a question that our CEO, global CEO, has been asked a number of times. The answer is no, because our production capability is there to make our pharmaceuticals, which, you know, is also an important place to treat cancer and hemophilia and multiple sclerosis. It's not just all about COVID. So we do not have the capability of changing that manufacturing to make the vaccines. But I think that the vaccine companies are certainly stepping up their capability of making more. And I think governments across the world are now starting to realize this is an important strategic consideration. And the pharmaceutical industry, of which I chair, we're already in negotiations to try and help the government of Canada find the right facility to create the right materials to prepare for future pandemics. And that includes putting a researcher in place to prepare Canada for a future pandemic occurrence should one occur.
So this is a rhetorical question, Ronnie, and something that I could probably say and you would probably refrain from commenting on, but is this an appropriate time to remind the government about PMPRB?
Yes, my favorite acronym. Well, as you're probably aware, we've been fighting this particular battle for some time. For those that don't know, the PMPRB is the Patented Pharmaceutical Pricing Review Board, and it's a bane in our side. They make it more complex and more bureaucracy that we have to get through to get our drugs reimbursed in Canada. This process was supposed to be introduced a more restrictive one 2.5 years ago, and again has been delayed. So the new regulations, we were told just after New Year, will be delayed another 6 months. I think it's an inappropriate time for the government to beat up on us during the COVID crisis, particularly as companies have bent over backwards to try and help governments to get those vaccines available and to see our drugs being used for COVID patients that were indicated for other reasons. So we continue that particular marathon discussion with government. I think there's a simple way of keeping prices under control, and PMPRB is not necessarily the way forward with that.
Well, you know, we're right beside you there, advocating for reform to even the conditions that go into PMPRB. And I did a very good interview on this topic with Pamela Freilich from Innovative Medicines Canada. So we expanded on that. So anybody that's interested in PMPRB and why that might be dangerous for Canadians, look for that podcast that I did with Pamela. This question has to do with HR, human resources. The question is about inclusive hiring and what positive things is Roche doing specifically around hiring persons with disabilities?
Yeah, great question too. I think first of all, HR is becoming an outmoded expression. Like many other companies, we now call it people and culture. And I think, you know, companies have to look at themselves and say, are we truly representing society in its purest form? Multiculturally, sexual orientation, and people with disabilities as well. We don't specifically seek to do that, but we have to make sure that everyone is considered. So ultimately, I think we're a very open environment to anyone with skills, and we will accommodate those skills in the company should that prevail. And if someone has a different point of view, then please tell me, because I would be very keen to get the feedback if there's a concern in that space.
I'm going to go back to the transformation over the agile management style. That had to involve some cultural change within the organization. How did Roche go about changing the culture from all of these senior managers who had been under one style of management, and now you have to change to another style of management? What transformation did you go through?
You have to spend an enormous amount of time in a mindset discussion. And the first thing that I did was make sure my leadership team were getting involved in that type of conversation. And I did say to them at the time, there are too many of you. We're going to go from 9 to 6 for my direct reports. So 3 vice presidents knew that they would be removed. So the first sign was, if I'm willing to do it with my leadership team, then there has to be consideration inside the rest of the organization. And then stripping away the titles. I think careers, and again, David, looking at our career, you were looking at a vertical climb. I think today it's much more of a roller coaster. You're going to jump from project to project. So that feeling of psychological safety that we all had working in a major corporation has been shaken a little bit. And I think you've got to spend a lot of time ensuring that the psychological safety mechanism is there and people feel secure, even though it doesn't appear obvious. So, you know, you're going to work on a project, that project's going to finish, you're going to report to a different group or work in a different team. And this is the type of mindset that's required. And I think it's slow to change. It's like changing an oil tanker in the middle of the sea, but it will change your recruitment policy. And these are the questions that we will be asking as we recruit in future and have people on board. I'm also leading a work stream globally on people and culture right now that's right into the details of that and what that will mean for Roche International in the future. So I think these are questions that would be posed very differently in an interview than we would have done 10 or 15 years ago.
So speaking about talent acquisition, another question from our audience is, what do you look for? I mean, certainly you need to have skill sets involved. You know, when you're dealing with pharmaceuticals, you need to have a certain level of education. But what are the other things that you look for in when you're hiring?
I think the key thing now is a collegial, people that are willing to work in teams, willing to roll their sleeves up. And I can say that the job descriptions of the future will be less specific and clear than the job descriptions of the past. So you're hired to work in blue, but ultimately you might end up in red or in yellow. So you need that mindset to make those changes, as I mentioned. So flexible mindset, transparency, and I think a level of trust and integrity in your colleagues at a higher level. So if I give an example, my leadership team at the end of the year, rather than do performance reviews one-on-one with me, we did a group performance review. So I would say that, David, here's what I admire about you this year, and here's what I would ask you to consider. Here are a couple of things I'd ask you to think about. And each of the team gave feedback on everybody else, including myself. So this is a very high level of feedback and transparency. I was delighted, and I've got, in fact, still in front of me here, pages of information that I've written down on the colleagues. Great to see, and I hope we can transfer that right through the organization. So that someone will take a colleague aside and say, you know, you're not pulling your weight. I need you to step up a little bit and do a little bit more, not just coming from the manager, but coming from the team itself. It's much more powerful.
As you've been going through this this transformation, what did you learn about yourself?
Having to let go. You know, you often sit in meetings and you know the answer, but you have to wait an hour till the team arrive at that point and not tell them. This is the biggest thing. And look, it's a delight. You've got to create space and as a psychological safety for people to take risk. And I think there's a little bit of a standoff at the beginning when you say, look, you've delegated to me, but what happens if I do something wrong here? So we've got F-up boards right through the building. So we try and celebrate if someone does make a mistake, that they recognize it's an F-up and then we learn from it. So there's no punishment by trying something different. We also took away things like budgets. So we no longer spend inordinate hours, weeks, months, days on presentations fixed against a particular number. Because let's face it, over the years, we all negotiated 90 when we knew we could achieve 100 so everyone would get bonus. The aim is now to try and get 120 or 130. It's a very different business philosophy, and it's gained us a lot of time to be creative rather than defensive.
Jesus, Ronnie, I've got my board of directors are on this call. Don't be telling them that. You talk about the F-ups and that brings about I'm trying to remember the name of the book. It'll come to me, but it was talking about innovative intelligence. Mm-hmm. And Dr. David, that's the name of the book, Innovative Intelligence. And he was talking about creating a culture and environment of innovation. And so many companies say, we want our people to be innovative. We want you to bring new ideas. We want you to try new things. Yet we punish them when it doesn't achieve the result that we thought it was going to be.
Right.
Achieve. So how do you create that safe environment? You mentioned a couple of things. Maybe you could dive into it a little bit more. How do you create that safe environment so people say, I know that Ronnie's not going to come down on me like a ton of bricks if I try this and it didn't work out?
You have to take the time and patience to ease people into that way of working. And I think it's an experiential thing. Once you've experienced it and you've failed and you've not been punished, you say, okay, I get it now. I'm willing to try a little bit harder and move this forward in a different way. And I think it's a collective responsibility. You're not trying to single out one person to blame. My leaders are working with the teams. They're intermixing with the teams. They're participating. They're sponsoring. So we're in this together type of mentality and not them and us. This is critically important. And I think as a leader, you have to take the responsibility on board. When things go wrong, you're accountable. When things go well, you're responsible enough to share that glory with the teams. And I think all the leaders that I work with have what we call superpowers, and they're identified as superpowers, be it critical thinking, innovation, process. And I think the teams are beginning to learn who to go to for what type of support and coaching as they go forward. And it lets me concentrate on the external part, dealing with government and dealing with the association and dealing with global, that my leadership team actually more or less focus on running Canada, and I try not to interfere, which is maybe a good thing.
That's it's a wise piece of advice to give to a lot of CEOs out there, is get the hell out of the way, and get great people in place and get the hell out of the way and let them do
exactly so.
What's your major concern these days? I don't like asking the question, what keeps you up at night? It's so passé, I guess. But what's your major concern right now? What do you think about as a CEO?
What worries me is exhaustion. I think we all are, this is lovely. I'm in my house in Oakville, and this study has become my prison cell for the past year or so.
Prison cell there, Ron.
Yeah, it's a nice one. I think the key is the energy that we gain by interacting with people. Human beings need interaction. And I think the one thing that worries me a little bit is the creativity will get dimmed. You can do so much on a Zoom call, but it's not the same as sitting in a room and interacting. And even taking the coffee break, and as I would say globally, even the beer breaks and the dinners are often where the real agenda gets covered. I think we're missing that a little bit in society. And I think we're missing that human interaction part. It's great with the family, but I still have a job that I have to take responsibility for. And I hope the vaccine I'll see us back into that type of environment. I think it will be different. People will work from home more often, but the getting together creates the creative friction, and I think that's what we need to return to.
Right. Yeah, I agree with you 100%. I mean, some of the most productive meetings that I've had with CEOs are the ones where we didn't have an agenda. we were going to get together for dinner or for lunch, and just talk about what's going on. You're absolutely right. What do you see as what's the future of your industry, and then we'll talk about what's the future for Roche specifically.
So look, for me, the future of the healthcare industry is infinite. You know, if we base our business on human beings have an infinite desire to live as long as they can, as healthily as they can, this is the perfect business model if you keep innovating. I mean, one thing I'm very proud of with Roche is they invest very much in the innovation. We spend something like $11 billion a year in research. It's a huge gamble. You're going to be sometimes finding one product out of 100 that you might test, but you have a breakthrough medication that makes a difference to a patient's life. This is something we can all gather around and support. And that is what gets me up in the morning and gets me excited. It's amazing innovation that comes forward. I think though digitalization, genetics, testing, all these things will come together. So it'll be more delivering a healthcare solution than just a pharmaceutical in the future. So companies will have to adapt and change. And I think what COVID has done will draw a line in the sand with the survival of the fittest. So some companies will not survive this. That's pretty clear, and we'll see a sea change, both in healthcare and of course other businesses as well, like automobiles and entertainment. When restaurants are going to the wall, it's so sad. I do hope there's a return to support local businesses though, and this is something we should endorse and support in Mississauga. Amazon's taking over the world. That may not necessarily be a good thing. If I look at the cardboard that I kick out every recycling day, it's phenomenal. The amount of shopping that takes place on your computer.
Well, I know I agree with you 100%. I can't wait until we can get back out there into the restaurants and support them and have those great meetings. I've got to flip back to the people side of the business because as every good CEO recognizes that without great people and without talented people, we really don't have a business. So with through COVID and everybody working from home at the very beginning, people, oh, this is great. I can get, I can work in my jammies and just put a shirt on, and this is fantastic. And then people realized living in a 500 square foot condo and not being able to get out was not the best thing to do. Some people wanted to get back to work. Some people didn't want to get back to work. How are you managing that at Roche with that flexibility with working from home or working in the office?
Well, I would say firstly, all credit to our IT department, because I think from a digital setup, we were very well placed to embrace this whole COVID nightmare that we're living through. I think too, now that people are starting to experience it, they in their own minds want to see a change. My colleagues in the UK, for example, have offered 3 different models. One, you return to work safely and you go back to the office every day. You want to work at home, and we help you set up that home office, but we want to make sure that from a physical, logistics, safety point of view, everything is fine. Or you can operate in a hybrid mode where you've got a balance of home and office. And I think that's a very commonsensical approach to how this may work. We haven't made a final decision yet in Canada, but I expect we may go forward in a similar vein. So if you're living in a 1-bedroom, 500 square foot apartment with 1 window, you may want to go to the office. We have a beautiful office in Mississauga, and we have a gymnasium and superb cafeteria. So there's a social aspect to that. Other people may say, you know what, I want to live in Alberta and I'm going to move out there. The issue is you're not going to get paid at Toronto rates, you'll get paid at Alberta rates, but that possibility, that flexibility will be there too. And I think that's the new world that we'll return to.
Have you converted your office into more of a hoteling environment yet, or is that on the horizon?
Our office is more now squad rooms, so meeting rooms for the teams to operate. So fewer offices, but more collective gathering. Even the boardroom we've done away with. It's now a focus room for the business. So the days of people coming in to do presentations that I would get bored at and want them to go to the final slide are gone. So we operate in a much more informal way, and with much less formality and more focus on speed and innovation than perfection. And that's difficult in an industry where you're dealing with people's health, because you've got to get things right. You can't afford to get things wrong. But in terms of processes to stop this perfection approach, to go with what we call a minimum viable product to get things started and moving.
A question from the audience about your corporate social responsibility focus at Roche. I know a number of companies during COVID have had to set that aside a little bit because we've had other things to really focus on. But what's your overall approach to corporate social responsibility? How do you show that at Roche?
Yeah, I think I'm amazingly, bearing in mind I'm Scottish, we're very well known for impunity and watching every single penny that we have. I'm astounded at the level of charitable causes and the attitude of Canadians to do this still. And I think that Roche in Canada has always been very supportive of local charities, that both hospitals for children and for the charities of Peel have been very, very supportive. It's more difficult because we're no longer in the office and having those events. But even outside the boundaries of Canada, we're supporting countries in Africa. We have a children's walk every year. So we try to do something in a very sensible and focused way. When I first came 20 odd years ago, we were spending money willy-nilly in charities. We tried to focus that so that we're giving a significant give to 2 or 3 charities rather than spreading it across hundreds, as was the case originally.
Well, I want to thanks to my team. They've just reminded me the book is Innovative Intelligence. The author is Dr. David Weiss. So if anybody's interested in picking that up, it's a great book on creating that innovative culture. I see one of your biggest fans is in the audience, Jen Nash, Ronnie, and she's been asking a number of questions. So I give credit to Jen for the questions. She's asking this one about enhanced collaboration between pharma and diagnostics in Canada. What's your take on that?
Yes, so Roche is the biggest diagnostic company in the world. We have a diagnostic division in Montreal as well as diabetes care. So there's 2 parts to that diagnostic part. As I mentioned earlier, I think we'll see more working together in a holistic way between diagnostics. The initial diagnosis, the treatment, the long-term follow-up and monitoring. So it becomes a patient journey. And I think even the hospitals these days are thinking of from birth to grave, how they manage health of an individual from the day they're born to the day they pass. So a combination of diagnostics and pharma will play a very relevant role in that. And we've worked very closely with our colleagues in the diagnostic space through the COVID crisis as well. So dealing with government, and I know I've had my colleague on the phone with Premier Ford and trying to get hold of materials, and it's been a very collegial approach, I think, in the healthcare space. And I don't see that changing. I think that's going to get enhanced as we go forward. And that's even with Roche helping the vaccine companies with their tests, so that the industry works in a collegial way too. It's nice when we compete, but it's also nice when we collaborate.
I'm going to bring it back to you personally as a CEO. Everyone is interested in knowing about work-life balance. I've interviewed a number of people on it. One person said it's not about work-life balance. It's more about work-life juggle. And another person said it's like a pendulum. You know, sometimes it's way over here, and sometimes it's way over here, and hopefully sometimes it lasts in the middle. What's your philosophy? Is there such a thing as work-life balance when you've got the top job?
Yeah, I think it's incredibly important. You've got to set the standard for everyone else. I mean, I would say most summer I'm on the golf course on a Friday. I think as long as you apply yourself to work, but make sure you apply yourself to the social part and balance the two, you're absolutely fine. I'm also in a normal environment, quite willing to go to Florida in early December and not come back to mid-January. So trusting your team, make sure you have regular contact. But if you don't recharge your battery and look after your own health, then you're not doing anyone any justice, not your company and not yourself and not your wife and family. So, you know, it depends on your personality and what drives you. But I give 100% to everything that I do, be it work or socializing. That might be my downfall eventually, but that's just my approach to life.
And certainly when you're working in a global organization, you could be answering emails 24/7. So,
And I do. It's my phone is attached to my hip, but I would rather deal with it then than let 100 gather and not reply. So one thing that my staff recognize me is I'm also answering even before they've written the email sometimes. So, and it doesn't have to be a long answer. It can be yes, no, maybe, or F off. But there's the at least to get the support and the clarity.
Ronnie, what advice do you have for other CEOs that, let's go with what advice do you have for people that are climbing that corporate ladder, so to speak, and want that top job? First of all, what advice do you have for them?
I think performance is always going to be a consideration. So do your best at everything that you do. Don't compromise. And I think one of the key skills I look for in people is courageous authenticity is say what you mean and mean what you say. It takes years to build up trust, but it takes seconds to disabuse that trust and lose that. So integrity and courageous authenticity to me are the two greatest skills to be shown. Even to look a boss in the eye and say that they're wrong. If they're a decent person, they'll come back and say, why do you think that? And explore. Be curious to why you have a different view. Don't always go with the crowd and go with the flow.
Well, I think you hit on something very important that great CEOs are very curious all the time, wanting to know how can we do better, how do we move forward on this, and certainly asking people, why do you disagree with me, certainly is a great place to start. Many people on the call don't know this, but you are part of our life sciences and healthcare sector for our Mississauga Economic Recovery Group. So thank you once again for joining in on that, even though you were a bit browbeaten by Jane Chung, the sector leader, to come in.
To join.
You're sitting around the table with a number of CEOs in that group. And so not that you're going to give this advice to them, but to all the other CEOs that are out there enduring what we're going through right now, what advice do you have for them?
I think we need to stick with it. There is a light at the end of the tunnel, which will probably be provided by the vaccine. I think we all have a duty also to support our home, which is Mississauga. And I think if we combine together to help that recovery, it will continue to make it a great place to live and work. And this is one of the great advantages of where we're based in the world, a fine country and a fine area. Let's keep it that way and let's enhance it if we possibly can.
Ronnie, it's great to chat with you. I look forward to getting the restaurants open so we can break bread and have another conversation. And by the way, I live on a golf course here, Ronnie. So if you ever want to get out and hit with the sticks, I'm happy to host you here. And so now, to appropriately thank you, and I'm going to call on the Senior Vice President from Arthur Gallagher Insurance and one of our directors on the board, Adam Novak. Adam?
Thank you, David. Much appreciated. Ronnie, it's a pleasure to meet you. It was really nice. Thank you so much for this informative fireside chat. We all now have a better understanding of Roche Canada's role in contributing to our society's well-being, and a little insight into Ronnie Miller, the CEO, the person, father, really cool. By way of your research and development, your products provide us with healthier and much longer lives. Be it through diagnostic, medication, or vaccines, we're all grateful to you. Thank you. I'd like to share with you a recent development at Gallagher as well. As you may know, Gallagher is an international insurance brokerage offering consulting services, risk management, and insurance placements. Healthcare happens to be one of our specialty sectors. Just yesterday, I found out by way of a teleconference with my US colleagues that last week, our Boston office onboarded a new client, Moderna. We are very proud of this achievement and ultimately very proud of our small contribution to the battle of the coronavirus pandemic. As well as pharma, Gallagher specializes in other manufacturing sectors such as industrial equipment, electronics, automotive, food and beverage, and many more. Again, Ronnie, I thank you for the time taken out of your busy schedule for this morning to share with us. Really, really nice to get to know you. Keep up the good work with all your colleagues at Roche.
Thank you.
Thanks, Adam. And a thanks to Kaiser Mason Ball and Gallagher Insurance for being our series sponsor for From the Corner Office. A very special thank you to our guest today, Ronnie Miller from Roche Canada. And to all of you who are joining us today, I want to thank you. And of course, to our technical team running in the background for making us look absolutely fantastic today. So thanks to them. So thank you again for everyone for joining us today. And from the Mississauga Board of Trade, we wish you continued success in your business.